Healthy citizens are the greatest asset any country can have. If a nation's citizens are not healthy, then it is less likely to prosper and doesn't qualify for a long haul. India has constantly apprised its citizens of the ongoing pandemic crisis in the country, and central government has taken every competent step to alert the people. Keeping the safety measures in view and prioritizing the well-being and robustness of its citizens, the Ministry of Home Affairs has come up with new guidelines for effective control of COVID-19. Defending the health of people. This time, the central government has focused on the test, track, treat protocol. In the first place, let us get to know about the enforcement of test protocol. The states need to ensure that the tests being conducted are uniformly distributed across all districts, with adequate testing to be done in districts reporting a high number of cases. In addition, the proportion of RT-PCR or reverse transcription polymerase chain reaction tests need to be scaled up to 70% or more on a best effort basis. Apart from this, the guidelines mandate that states and union territories where proportion of RT-PCR test is less should rapidly increase testing to reach a prescribed level. Let us know the tracking guidelines for effective control of COVID-19. Have a look. States are required to isolate new positive cases, and their contacts are to be traced, isolated and quarantined at the earliest. To control the spread of COVID-19, containment zones are created, and taking into consideration the guidelines prescribed by the Health Ministry, these containment zones are required to be carefully demarcated by the district authorities at micro level, and also the list of containment zones are required to be notified and shared with the Health Ministry by the respective district collectors. Within the demarcated containment zones, only essential activities will be allowed, and except for medical emergencies, essential goods and services, the movement of people is restricted in these zones. Moreover, intensive house-to-house surveillance will be carried by surveillance teams, and besides this, the persons who are found positive, their contacts, tracking, identification, quarantine and follow-up will take place for 14 days. And 80% of contacts are required to be traced in 72 hours. To have a clear vision of these guidelines, let's move towards the treatment and vaccination protocols. While treating, quick isolation of COVID-19 patients will be ensured in treatment facilities or at home. Clinical intervention should be administered along with states, ensuring adequate availability of COVID-dedicated health and logistics based on their assessment of the case trajectory. It is also mandated that effective infection prevention and control practices should be followed in treatment facilities and by healthcare workers. The National Expert Group on Vaccine Administration for COVID-19 provides guidance on prioritization of population groups, procurement, inventory management, and vaccination selection, delivery, and tracking. These are the guidelines that are mandated for defeating a deadly virus, COVID-19. And as a responsible citizen, it is our duty to abide by the initiatives pulled by our government for our well-being. Use masks, follow COVID-appropriate behavior, and maintain 2 gaj ki doori. We will meet again with more information. Thanks for watching.